Hey everybody, David Levestein. This is Back to Business on 103.9 LI News Radio. If you're a business owner, if you're a professional, please contact me at my show at jvcbroadcasting.com. That's my show at jvcbroadcasting.com. I want to hear what you have to say, and I know all of Long Island will as well. What are you doing? How are you helping Long Islanders? How are Long Islanders helping you grow your business or your practice? My show at jvcbroadcasting.com. Great guest. Great guest. Are you ready? Are you sitting? Are you paying attention? Great guest. I have Dr. Tommy O'Brien. Dr. Tommy O'Brien has a practice in Patchogue. And the phone number is 631-980-8200. DrTommyo.com. DrTommyo.com. He's the author of 2 books. One is called The Medical Marijuana Real Life Success Stories. And the other is Holistic Healing, True Stories from the Leading Expert in Modern Medicine. And that'd be you.
That's correct.
That's me, you. It's good to see you. It's good to meet you.
Thank you.
We've been sitting here for a while, getting to know each other, and a lot of great things. Tommy, let's talk about where you're from and how you chose to go into medicine.
Sure. Well, thank you for allowing me to be a guest on your show.
Yeah, absolutely.
You know, I love helping the community. Well, actually, I'm born and raised on Long Island. I grew up in Freeport.
Okay.
So I graduated. I'll give my age away because I'm not worried. I graduated in 82.
82. Let me figure that out. 82. If you're 57.
57. That's correct. Yes. Then I graduated and I went to Nassau Community College and I got my associate's degree in biology.
Right.
I then transferred to New York Tech, New York Institute of Technology.
Right.
I finished up in a year and I received my bachelor's in biology.
Right.
Then I wasn't ready for medical school yet because you need to have your MCATs, and I just didn't have enough time to prepare for it. So I transferred into New York Tech's master's degree program in clinical nutrition.
Right.
At the same time, I was teaching high school in a local school district.
Yeah.
And then
Where did you teach?
I was at West Hempstead High School. Yep. I started off as just a substitute teacher, and then I became a full-time sub.
Right.
And because of my biology background, we had a teacher took a leave of absence because she was pregnant.
Sure.
So I need someone to fill in. I'm like, yes, I can do this. This is my background.
Did you enjoy teaching?
Oh, I love teaching. I teach every single day. That's part of my practice.
Right.
My practice is a holistic approach. I'm going to give you the care that you need. I'm going to educate you because that's more important than the actual pill. If you don't understand pathology, if you don't understand the medicine, why this happened, how we're going to prevent it in the future.
I want to tell you something. That is so true because people go to the doctor, I don't feel well, and they give you your medication, they send you home. But I think that doctors actually should educate their patients, say, listen, this is what's going on with you. This is why. And this is what you can do to make sure this doesn't happen.
Yes.
You know, it's not just here's the pill, go feel better, and just finish your prescription. I want to make sure this doesn't happen to me again.
Right.
And it could be as simple as like I keep getting chest colds, well, dress warmer, and whatever it is, just to make sure these things happen. But okay, continue. So you were teaching. Yep.
And at the same time, I was preparing and studying for my MCATs.
Right.
I chose a medical school out in Iowa. I'm an osteopathic physician. Originally, I was an athlete growing up. I played baseball, I wrestled, I swam, I dove. And I was looking towards chiropractic because I like the hands-on. So I was in NASA's pre-chiropractic program. And right before graduation, that's when I discovered osteopathy. And
now, back then in the 80s, the New York Chiropractic College was right across the street from New York Tech.
Yes, it was part of New York Tech's campus.
Oh, it was?
Yeah.
Oh, I know it was right across the street.
That's correct.
So I went to CW Post at the same time you were at New York Tech.
Yeah.
So I remember seeing the chiropractic school there.
I think that was an elementary school at one time.
Oh, was it?
Yeah, because it's just one story.
Yes,
we shared the same library. Before they built New York Tech built the new library, we shared, it was called the 200 building. So on the second floor, we had a little room, and that was the library. And then there was a little section for the medical, where they had all the medical books, and both the osteopathic students, because NICOM was located at New York Tech, which is New York's osteopathic medical school, and the chiropractic college, which is across the street. So
at first you were thinking about becoming a chiropractor.
That's correct.
And then you changed to medical because why?
Well, I felt that right before I graduated, I just felt it was limited, just manipulation, and I wanted to be able to offer more to my patients.
Right.
And I was very, my father and my mother, both my parents, mom and dad, were educators, and my father taught at Nassau. He's taught there for 54 years. My mom taught 35 years, and so I had a lot of mentors growing up because I basically grew up on the campus, and everyone, all my mentors kept saying, you really need to learn about nutrition, and kept pushing nutrition. You want more of a holistic approach. And then I basically said, I need more. And then my father basically said, I'm glad you got to that point, Tommy. Why don't you, and he made a phone call. He says, are you available tomorrow? I said, yes. I want you to go over to NICOM, and I want you to speak to this individual. And I was like, I don't know what NICOM is. And that's when I discovered osteopathy. He said, this is perfect. This fits my personality. It has a holistic approach. I can do surgery. I can prescribe medications, and I can manipulate. And I said, this is it. It's a holistic approach. It has everything. It encompasses everything. Right. So I went home.
So, by the way, folks, don't misunderstand. Being an MD and being a DO, doctor of
osteopathy. Mm-hmm.
Osteopathy?
Oh, yes.
Yeah.
Or an osteopathic physician.
Osteopathic physician, right.
Yes.
They're the same thing, except DOs actually take it a step further.
Yes.
Right. So
manipulation.
It's not the other way around. It's not MDs, because people in their mind,
Right.
MDs are not more educated than DOs. DOs actually have the same education as an MD, except there's a second level to that education, which is the manipulation.
That's correct.
Right.
Yes.
So they can do what a chiropractor does, but in a more medical setting, right?
If you want to define it that way, our techniques are similar. I always say when I educate the community, we're both in a fruit family, but one's apples and one's oranges. We have a lot of the original techniques are the same,
right.
And then as chiropractic started to develop, they came up with their own techniques, but the core techniques, the Kirksville Crunch, what we call Dr. Still's techniques, the original techniques, they're exactly the same.
Say it again, the Kirksville Crunch?
Yeah, that's where our founding father was in Kirksville, Missouri, so we call it the Kirksville Crunch.
Okay, that sounds gross to me. So, or if it's the Kirksville Bakery, it could be delicious.
There you go.
Yeah, so it's either delicious or it sounds kind of dangerous.
Right.
What is the Kirksville Crunch?
That's what we call the thoracic thrust, and that's just a technique. It's not. It's a gentle technique.
Oh, okay.
Yeah, you're not. It's not like WWF, and you're on the third rope and you're coming down on top of a patient.
So after you graduated med school, you came back to New York?
Yes, I moved back to New York after I finished in the mid '90s, early to mid '90s, and then I did my residency. My first year, my internship, because in order to be an osteopath, a licensed osteopath, you have to do an internship, and where you rotate through every discipline. And then if you go into like family practice, which I did, or internal medicine, that first year counts towards your residency. For residency, it's mandatory minimum 3 years of postgraduate work. Okay.
How do you afford to live when you're still learning?
I'm sorry?
How do you afford to live when you're still learning?
Oh, well, you're given a salary that's very little. And,
Yeah.
I mean, I think I was making $40,000, and I was teaching high school.
Right.
4 years before that, I was making more money.
Right.
And it's starting all over. You have to get your.
You really need to love what you're doing.
Yeah. Oh, it's a passion. Yeah. If you're going to dedicate and make sacrifices. For me, it was 16 years of sacrifice. So you're talking all my undergrad, grad, medical school, and then my residency. And by the time I graduated, it was 16 years.
Wow.
For the average doctor, typically it's 11 years. Like if you wanted to be a family practitioner, 4 years of college, 4 years of medical school, 3 years of residency. But I have extra degrees, and I spent extra time for education because I just wanted to really be able to give more to my patients. Especially, I focused on nutrition. That's why I have my master's. That's 2 years, and I did. It's 2 years in addition, and then I had to write my master's thesis, and I was lacking one class, so I had to wait for that cycle around again, so that kind of like pushed another year. So now that's an added year.
Now, in addition to that, you're a veteran. You're in the Army as well.
Yes.
And you explained to me that you were in charge of New York City's triage, is it?
Oh, well, I was I was in New York Guard, the 88th Brigade, and I was the commander of the 102nd, I'm going to say just Med Corps, because it gets a lot of initials after it. So I was in the commander of the medical unit, and I was responsible for all in New York City, all 5 boroughs. and moving up towards Camp Smith, because Camp Smith has a medical unit, and they kind of like there's a little overlap upstate, and then I also covered a little bit of Nassau County because here out in Farmingdale, we have a medical unit there, so it's a slight overlap.
So myself and I'm sure the listeners all thank you for your service and donating your time and your education to helping us, our troops. DrTommyO.com, DrTommyO.com. His office is in Patchogue. His phone number is 631-980-8200. He's also the author of 2 books. One is called The Medical Marijuana, Real Life Success Stories, which we'll talk about. And the other is the Holistic Healing, True Stories from the Leading Expert in Modern Medicine. Let's talk about the holistic healing, okay?
Yes.
Holistic healing, when people hear holistic, oh, it's holistic, things like that, they don't, it's a very abstract word. What does it actually mean to you in your medical practice?
Right. Well, I take a holistic approach. So I'm looking at the mind, body, and spirit, or mind, body, and soul.
Right.
I treat all my patients like their family. So I sit down and I listen to them, and together we develop a plan, an approach of how we're going to manage their care.
Right.
Again, it's the education, not the pill. Yes, sometimes you'll need the pill to take care of the condition, but we want to understand why, what happened. It's like writing a report: who, what, where, when, why, and how.
Right.
And when I have all my students, I teach it to them. When I say, okay, I want you to present to me, and they're learning how to present cases, is that just like a book report: who, what, where, when, why, and how. And if you answer that and you understand that, you can help your patients.
So, like, again, just to break it down in simplicity, right? When somebody has high blood pressure is a symptom, right?
That's correct.
Of something else.
Yes.
So people go, oh, I'm taking a high blood pressure medication, right? Okay, but why do you have it?
Right.
Right. And some people, they don't even get to that thing. I don't know. I got high blood pressure. My doctor gave me carvedilol, whatever it is, Right. But they don't understand why they have it. So high blood pressure is a symptom. Even erectile dysfunction is a symptom of something, right?
Right.
So these are all symptoms. So it's interesting to me that people treat the problem, but not the symptom. Would you find that to be more the case than not?
Oh, absolutely. Yeah. We if you want to really help an individual, we need to find the underlying cause,
right,
and then address that. And unfortunately, the way medicine developed in America, we're addressing the symptoms rather than the cause. That's why we don't really see many practices focus on preventative care.
Right.
So we need prevention.
But do you think that people spend not enough time with their doctor sitting in that room waiting? You spend a lot of time waiting to see a doctor. Then you get in the little room to wait for your doctor, and then your doctor's in and out in 30 seconds. So, so do doctors even have the time to educate their patients, and why do you have the time?
Yeah, well, that's absolutely right. Well, the way the system is, and with the lack of reimbursement, you have to see volume. It's a volume game, so you're in and out. So you're going to have your ancillary staff do all the vitals and get the history, and the doctor will come in and only spend maybe 5 minutes. What's the problem? Yeah, here it is, boom, done. So there's no time for education.
So doctors, in some cases, maybe many cases, maybe too many cases, are trying to see as many people as they can during the day.
Well, they're forced to do that because of lack of reimbursement, and you
Right.
really unfortunately it's a business, and insurance companies are in business to turn a profit,
Right.
and so someone has to take the loss, and that's the physicians.
It's the patients too.
Oh yeah, absolutely. No, the patients take it.
We take the loss too because we don't get to spend. Because sometimes you go into a doctor's room and you're like, wait, I got a question for you, and they listen to you, but they got to get to the next room.
Absolutely.
Yeah. So how are you different?
Yeah, so I have a different program, and my program, I call it a medical membership program, just like going to a gym. So people, your listeners, what is a medical membership? It's considered concierge, but it's like a membership, so you pay on your credit card $100 a month.
$100 a month.
And then you can come in and see me as many times you want, and I'm going to spend quality time. So if I need to spend a half an hour with you, that's your half hour.
That's less expensive than most insurance plans.
Right.
It is.
Yeah. It's not insurance because I'm not licensed for insurance. What you're doing is you're paying a monthly membership so you have access to me.
Right.
And then I have negotiated with local diagnostic centers, so we're going to be able to keep the cost down. So let's say you do not have insurance. I can unable to afford insurance. So for $100 a month, you can come in as many times as you want. So let's say I see you today and I have to do a follow-up in a week. Well, it's only $100. It's not $200.
Not $100 per visit. It's $100 per month.
That's right.
To see your doctor, to sit with your doctor, and to get the education. You see, at this point, you want to educate your clients.
That's right.
You want to make sure they don't have to come every week. You want to say, hey, and if they are coming every week, it's a kind of a maintenance to say, hey, you're losing weight, or you've been exercising, your blood pressure is getting lower on its own. I mean, these are things that you work with people, right?
Exactly. Yep.
Yeah.
So, going back to $100 a month, it's just like a gym membership, no different. So, we charge to your credit card each month $100, and you can come in. So, let's say you do not have insurance, you do not have a primary care physician, because I'm a family physician. That's what I did my residency.
Right.
Well, to continue that, I transferred up to St. Barnabas in the Bronx. I trained in the Bronx. I practiced in the Bronx for 16 years, and then I finally opened up a practice in Manhattan. So, you're getting a Manhattan physician here on Long Island in Patchogue.
Right.
I was on Park, between Park and Lexington. I was in this sweet spot. I have billionaires and millionaires as my clients, my patients, just that I moved back to Long Island and I opened up an office here. Yeah. So for $100 a month, you can come in as many times as you see me. It's not rushed. You're getting the quality care, the care that you deserve and you're paying for. You're not being rushed. So if you need to speak to me, you have access to me as well.
Right.
So if late at night there's an issue, you can give me a call. You're dealing with the physician. You're dealing with the owner. You're not dealing with an employee of a large conglomerate. Like
so
a hospital.
You get to know your patients.
I know them.
You know your patients, and you're helping them through their problem, not just treating the symptoms, but treating the causes of these symptoms as well. DrTommyO.com, DrTommyO.com. His office is in Patchogue. The phone number is 631-980-8200. That's 980-8200. DrTommyO.com. What you need to do is go to DrTommyO.com, register, making appointments, speak to this gentleman, and he will see you through your health. To me, it's like finding a personal trainer for the inside of your body.
Right.
I mean, to me, there's nothing better. You go to the gym, you get personal trainers to work you out, right? I mean, why not have a personal trainer for your organs?
Right.
The important muscles.
Yes.
The ones that make the outer muscles look better. Because people need some people don't work on themselves from the inside out. It's always the outside in, How do I look in these pants? I don't know. How do I look in the, do I look good? Do I feel right? But how do you do it on the inside?
Right.
I know somebody who unfortunately passed away who was tall and thin, and but the doctor said that they were kind of skinny fat, and they look great, but they had a lot of visceral fat riding in between those organs, which is the stuff that kills you, right?
Yes. Yep.
Right. But you don't know that. Mm-hmm. You just say, hey, I look great. I look great in these clothes. Yeah, so what? You also look good in a coffin now, So that's not what you want. Okay, so let's talk about holistic healing. Tell me about the book and what people can expect. By the way, these books are available on Amazon. So go to Amazon. You can just you can actually put Dr. Tommy O'Brien in there. The books come up, or Holistic Healing and Medical Marijuana Real Life Success Stories. Right. But let's talk about holistic healing. Tell them about the book and what people can expect when they read this.
Right. Well, we'll start off with the first book. I'm just and then we'll go into that. But the first book, I wanted to introduce the topic medical marijuana. Right. But I didn't discuss and introduce myself.
Right.
Because I wanted to focus on the topic and not on me.
Sure.
The second book, Holistic Healing, I introduced who I am to my readers so they can get an understanding of where I started to where I am today and my mindset of what each decision I made. And then there's a continuation from my first book, and then I introduced osteopathic manipulative medicine because I do practice that every single day. The term that more people will be familiar would be adjusting. Osteopaths, we say manipulate, but chiropractors will use adjusting. So more people will be familiar with adjusting. So I adjust every single day. I'll use the term that someone's familiar with.
Is there, with medical marijuana, is there still a debate whether it is, it's not a treatment for the problem, right? It's a treatment for the symptoms.
That's correct.
Treatment for the symptoms. Is there a debate in the medical community as to whether it's effective or not?
Absolutely, yeah.
Why? If it's proven to work, the only way it would be a debate is if someone said, hey, I've been doing this, it doesn't work. Right. But if patients are being affected positively by that, why is there still a debate?
I believe it's in your upbringing, and we have the old guard and the new guard. The old guard are very conservative and strict. Slow to change.
Yeah, but even if the old guard, they've been practicing medicine for 50 years, but still during their course of being in practice, new medicines have come around.
Yes.
Why are they so hesitant about this one?
I think just the stigma.
The stigma of pot.
That's correct.
Yeah, because that's what they refer to it as pot.
Right. Yeah. Well, that's why the terminology I use, I'm very careful. I use medical cannabis versus marijuana. So I
Right.
try to reference as cannabis. So
Okay.
that takes the stigma away. I don't use the street terms, joint and pot.
Right.
A lot of times we'll use bud or flower
Right.
to soften it out a little bit.
Right.
And it's just the approach. But the old guard, and the old guard is now retiring and basically fading out of
Right.
medicine, and you're seeing change, and we're introducing new ideas and concepts.
Can this be abused like opioids are abused at times? Like, is anything really?
No, it could be abused.
Yeah. Xanax it can be abused.
Absolutely. I know that people will say, well, it's not addictive and it's never been addictive. Well, if you're craving it, that's an addiction.
Right. And it is.
Yeah.
All right. Listen, I want to thank you for talking to me about this. And my name is David Levestein. This is Back to Business on 103.9 LI News Radio. I've been speaking with Dr. Tommy O'Brien, drtommyo.com, drtommyo.com. Make an appointment. Visit with Dr. Tommy O.
Another one bites the dust.